Hello everyone. Now I'll be discussing question of neurology. So we have a 7-year-old child, pediatric patient. He has seizures, tonic-clonic lasting for 5 minutes, and loss of urine was confused afterward. Family history is significant for maternal uncle with fragile X syndrome who lives in a assisted living facility. Axillary and inguinal fold have multiple freckles. Patient diagnosis is most commonly likely to have additional finding in this patient. Well, first of all, we should be very clear about what is the diagnosis, and later on only we can say what can be the additional finding. Well, the right answer in this case is optic pathway glioma. Well, why is the answer? This patient has seizure activity that we have seen. Patient developed seizure. That's why he has been brought to the emergency department. Skin findings are classically of neurofibromatosis 1. What are the skin findings that we are getting in this patient? Well, before I talk, what is NF1? It's an autosomal dominant condition. Neurocutaneous syndrome. In fact, all neurocutaneous syndrome, all of them are autosomal dominant. Is additional knowledge for you. Well, it is caused by mutation in NF1 gene. Now, the clinical features that include in this NF1 are capsulate spot, axillary and inguinal freckling, Lisch nodules, and neurofibromas are the important findings that we get in these patients. Now look into this lovely picture. This is NF1, optic glioma, Lisch nodules, capsulate spots, scoliosis is there, neurofibromas on the skin, they are all seen in this patient. Pseudoarthrosis. Well, this is a typical capsulate. This is the most important. Any exam, well, they will talk about NF1, they will talk about capsulate. Rather, other way around, if you are getting capsulate, then 99% you are dealing with NF1. So you can't. This is a golden line to remember. NF1, capsulate spot, or capsulate spot is NF1. I made your work very easy. Well, I talked to you regarding axillary freckling also. Freckles are cluster of concentrated melanized cells. They are most easily visible with the fair complex that you can see in this lovely picture. Very easily visible in the axilla. Okay. But now I have a question for you. Stop the video, write down the answer in your copy. Why these freckles occurs? What are the basic mechanism? What is the reason behind this? Okay. Well, write down the answer, stop the video. Now, freckle, they do not have increased number of melanin producing cell or melanocyte, but they have melanocyte that overproduce melanin granules. Let me see. So let us see, these are the pigments that are being produced by the melanocyte. Here the number of melanocyte remain the same, but now it become like this. You can compare the same, the number of melanin pigment are much more. So that's the reason why they are making freckles are getting made. So this change the color of the outer skin cells because of large amount of melanin. Well, Lisch nodule we see in the eyes. What are Lisch nodules? Okay. They are pigmented hematomas, nodules, aggregate of dendritic melanocyte affecting the iris. That means same melanocyte which we discussed in the skin, they are also present in the iris and they are making nodules, so-called Lisch nodules. Neurofibromas, very obvious. In fact, once you are seeing like this, again, this is one more finding which is classically seen in NF1. But because it's so obvious that nobody will talk about in diagnosing or in a question, they'll usually talk about capsulate spot as far as exam point of view concerned. But to diagnose, this is very obvious from a distance. You can diagnose a case of NF1. Now, well, as I discussed, we are dealing with a case of NF1. There are neurological disorder like cognitive deficit, seizure, as we saw in this patient. Intracranial neoplasm are seen in these patients. Okay. Well, optic pathway glioma are seen in these patients. Now, I have one more question. Stop the video, write down the answer. Optic pathway glioma is seen in which age group? Maximum in which age group it is seen? Okay. Well, stop the video, write down the answer. It is in the young children, like our case also. Our patient is a 7-year-old child boy and he got optic gliomas. Now it causes vision deficiency as the lesion expand and invade the visual pathway. And yearly ophthalmic examination is mandatory to rule out this problem. Now option A is incorrect, acoustic neuromas. Again, stop the video, write down the answer. Acoustic neuroma are most likely seen in which type of neurocutaneous syndrome? It is seen in NF2. They are nothing but vestibular Sonoma, NF2, and NF2 don't have capsulate spot or aggressive freckling is not seen. Intracardic tumor, again a question for you, stop the video. This is seen in which type of neurocutaneous syndrome? Well, intracranial cardiac rhabdomyoma are classically seen in patients with tuberous sclerosis. Okay, they are benign tumor. Now, other feature that we see in tuberous sclerosis, ash leaf spot, angiofibroma, and shagreen patch. But I have got few more questions to ask you. Stop the video, write down the answer. Shagreen patch are seen most commonly in what place, what site? Same thing, ash leaf spot are most commonly seen in which site of the body? Write down the answer. Well, shagreen patch that you can see, they are thick, skin thickening over lumbosacral region, shagreen patch. The answer of this question is lumbosacral region. Similarly, the ash leaf spot, they are hypopigmented. They are again seen in the lumbar area or in the abdomen. They have a pointed end. You can see this picture, more of a pointed picture, just the way ash leaf has. You can see one more picture of ash leaf spots. Now, testicle enlargement, it is seen in Fragile X syndrome. It is setting of seizure, definitely. Now, very important question. What is the inheritance of Fragile X syndrome? Quickly stop the video, write down the answer. Well, the answer is it's a X-linked dominant condition, not recessive, point to be noted. The features are intellectual disability, large ear, long and narrow face, macroorchidism after the age of 8 years. Capsulates and freckling are not seen. In fact, whenever you get this and axillary freckling, this virtually you are 99% you are dealing with the question of NF1. Well, extra point about Fragile X syndrome, broad head, elongated face, large prominent ears, crossed strabismus and high arch palate are the other findings that we see in these patients. Okay, look into this. Prominent forehead, long ears, narrow face, prominent chin, and neurobehavior problem, and macroorchidism. You can see the large testes are there. Well, option E is incorrect. Sturge-Weber syndrome, we get vascular malformation. As a triad of port wine stain on the face, ocular disease and leptomeningeal, where we get capillary venous malformation. Now, they can have seizure due to these intracellular vascular malformation. But again, I have a question for you. I talked to you regarding ocular disease may manifest in Sturge-Weber syndrome. Which ocular lesion are seen in this condition? Stop the video, write down the answer. Typically visual defect or glaucoma. Glaucoma is the most widely asked question in these patients. Port wine stain that you can see on the face. Golden line to remember, NF1 is an autosomal dominant condition. In fact, all neurocutaneous syndrome are autosomal dominant. Additional knowledge. Now, NF1 is capillate spot and axillary and freckling. If you are getting these two things, capillate and axillary freckling, you are dealing with NF1. Golden line to remember. Patient have increased echo seizure, learning disability, and optic pathway gliomas. Thank you very much.